The Shaking My Head podcast features interesting discussions about topics that have frustrated the hosts, Alex and David. Each episode is meant to question the quirks of society and bring to light subjects that intrigue or bother us. If you're here because something has you shaking your head, even if it's just life, you're in the right place.
So I went to the doctor in February, and they had to, so I had to get surgery like in my mouth because I bit my lip when I was playing softball.
Mm-hmm.
Apparently I bit through a blood vessel.
Holy shit.
And so there was a big bump inside my mouth. Because it was it healed over itself, but the bump never went away. What's that called?
Scarred.
It's like a benign scar or something, like a...
What? Okay.
It's like if you get injured and your scar and your skin heals over your scar, but you have a bump.
Yeah.
Well, anyways, I had that in my mouth, so I had to get surgery to get that removed. And I had surgery in February.
Uh-huh.
And the day I did the surgery, I paid the doctor because you got to pay an amount when I get there.
Right.
And then a month later, I got a bill saying oh, there was some additional exam fee that's owed. And I paid that. Because it was relatively low. It was maybe $100, something like that. And then maybe a couple more months later, I got another bill saying, oh, you still owe $40 for a different exam fee or something. And I was like, okay. And so I still paid it. And now I got another bill. It's 6 months later. What is it? It's July. This happened in February, so that was 5 months ago. For another bill where I owe another $40. And all it says on the line item is tissue exam. And then it shows when my bill was due. And then so what they do is they show the charges, they show how much insurance pays, adjust it, and then they show my balance. And it looks like insurance covered a lot. But so a couple problems with this. A, why am I getting bills 6 months later, 5 months later? This is just crazy. I don't know what's going on. And B, why can't the medical system why don't I pay everything up front? And I know they have to send exam results to, I guess, different businesses. They don't do the exam. The doctor doesn't do the exam personally. It does they send the tissues to be examined to other places, but they should add that into the bill. And I guess part of that is what pissed me off is I don't know if this is true, but I have a sneaking suspicion that there's some third party who buys information from doctors.
Probably.
About medical exams, medical procedures. You go to a doctor, you get a procedure, and then your information of that procedure is sold to some third party. And I think that third party then creates these very generic bills under a lot of different names, a lot of different companies. Because mine says DeKalb Pathology, and I went online to look at it. It's in West Virginia, apparently, DeKalb Pathology. And I look online, and there's DeKalb Pathology, and there's one Google review, and it's 1 star, and there's no doctors there, or maybe one doctor. And I feel it's some scam or something being run, where they just bill people and they see who pays it. Right now, I haven't paid this. This thing is supposedly it was due in May, and I got this in July. So not only is the statement date say May, I didn't get the copy until July. And I don't know, it just feels really shady because I feel like if I pay this, because they make it seem like, oh, you owed a $200, but insurance covered 150, so you only owe 50. It's great. But I feel like if I pay this, it tells that company that, oh, this guy just pays bills, like random bills, and we'll just send him another bill for some random line item in another month. On the flip side, I'm worried if you don't pay medical bills, doesn't that hurt your credit?
It can, but I have this coworker who used to work in collections. I don't know if it was medical collections. You can basically dispute these marks against your credit score. It's just a pain in the ass. I think there's ways to not pay, but it's just sometimes not worth it. But then you're saying, what happens if you keep paying it and they just keep trying to scam you? Which I could see happening because I feel like the medical industry is pretty unregulated.
Yeah, I just...
I mean, I've had...
Because I've already paid a couple of these, and I'm like, why is it still coming? I need to call my doctor and confirm, but I feel like my doctor's
He's
gonna
gonna
be
say,
like...
I don't know, probably is what they're gonna say.
Gonna say what?
I feel like they're just gonna say they don't know. They're gonna be like, we don't do billing, you have to talk to...
Yeah, they're just gonna be like, we sent it to somebody, but whoever they send it to.
Yeah,
It's just...
bunch of bullshit.
Yeah, it is a bunch of bullshit. I don't know what's going on.
Right. The medical industry here is pretty fucked up. And I don't know what much as we can, as consumers, can do about it, unfortunately. Why does every other freaking country have national health care and only America doesn't? I'm pretty sure it's just because it's being controlled by the rich people, politicians, basically whoever benefits from it. I had a staph infection in my finger, and I didn't have health insurance then, which is the worst. I was like maybe half a month from actually getting health insurance from my company because I was starting a new job then. Long story short, I got like all these bills I used to, like I paid off my first because I was like, oh, that's it. Okay, I can manage that. And I started getting like other bills, and I had to go see a hand surgeon, and it probably went north of $6,000, maybe $6,500. Like I lived in Taiwan for 2 years.
Mm-hmm.
And everything's so damn cheap there. Like here, even with your normal dental insurance, you probably have to spend how much? You probably pay like $15 a month, maybe, which is supposed to cover basically your 2 teeth cleanings, and then it may help with the cost of a filling. In Taiwan, every time you go to a dentist visit, or even a doctor visit, it's like $7 US. I went there once. I think I got a tooth cleaning and like 2 fillings I needed filled, and they did it all for $7. And I'm just like mind blown because here, if I was to do the same thing, I'd probably be paying like $100 a tooth to get the filling, and then the tooth cleaning would be covered by my dental insurance. One other thing I noticed is if you need any medication, it's really cheap. It's only a few bucks. And they actually only give you the amount you need versus here where you either have a copay or you pay full price until you hit a certain deductible. But also that, like, medicine, I haven't gotten medicine here in a while, but it's at least $20-$30 at a time, right? And they also give you way too much medication. I think there's a few other things, like if you go for a cold, you probably not. I mean, they may give you some medication that may make you feel a little better, but doesn't necessarily heal you because flu is, or cold or flu, it's a virus. It's a viral infection. Nothing actually kills the virus. It's just they give you some kind of pain suppressant or something, or there's a lot of things where you really don't need to go to the doctor. It just makes you feel better, but it's really up to you. But do you want to spend? The other thing I was gonna say is every time you go to the fucking doctor, they think their time is so important and yours isn't. So you're sitting there, you make it on time, or you make it even beforehand, and you still have to wait like 30 minutes for a doctor, or just to even go into the room. On top of that, you have to wait for the doctor because the doctor might be seeing another patient. So like you're sitting there for an hour and a half, and you're paying like a $30 to $50 copay usually. And then they just usually, and like the other thing that really annoys me is I feel like a lot of doctors actually don't know what the fuck they're doing. Sorry guys, but I knew I had a sinus infection. And the doctor said, no you don't. So he stuck a little scope in my nose so he can actually see what's in there. And he's like, oh, you do have a sinus infection. And I'm like, yeah, no shit.
I mean, doctors, not only do they take on more patients than they should? Like that, I have that issue every time I go to my primary care doctor. I'm sitting there for like an hour. They're like, your appointment is at 10 a.m. and I get there at 10. I get there early. They're like, come early. To
It doesn't matter when you get there. You're always waiting, regardless. And they don't ever value your time. They're like, oh, we're the doctor. You know, our time's more important than yours. Like, there's people who make more money than you, and yeah, you're supposed to be saving lives, but sorry, like, you're not. Like, most of these patient visits are pretty mundane, you know, reasons for going in. And the problem is our time is valuable too. We're taking time out of our days and we're paying a lot of money to go see a doctor, so you should respect our time as well.
You wait an hour, then the doctor sees you for 5 minutes, and it's like, oh, you got this and this? Okay, we're done. Thank you very much. Let me go on to the next
It's
person.
like they don't even bother. I feel like they don't even bother listening or really taking into consideration what you have. It's just you say the first thing and they're like, okay, there you go.
Yeah.
And I feel like there's misdiagnosis in that point, in that situation. And then on top of that, I think that's why people say medical costs are really high. It's because there's so many lawsuits. But one, I could definitely see misdiagnosis. But two, I think that's just an excuse for people to charge more too. So.
Yeah, they'll come in and they'll be really quick, and then they'll say you should do this. And doctors are traditionally supposed to be the professionals that are supposed to have.
Yeah, they're supposed to tell you what's wrong with you, right?
They're supposed to be like healers, you know, in the traditional sense of like someone you respect and you listen to because they have a degree. Now I'm like, I don't.
Right.
I can't even trust doctors anymore.
People who go overseas to get procedures, there's actually world-renowned doctors, and there's also some procedures that are not like FDA. Is it FDA approved or whatever? No, it's not FDA, but there's just like
FDA is Federal Drug Administration.
Maybe but there's certain procedures that are not allowed in the States, but are allowed in other countries.
Yeah.
And because of all the backwards bullshit there is here, people have to go, like, they are forced to fly overseas because they may die if they don't get the treatment they need.
Right.
And it's due to, I think, the regulations here. Stuff like human cloning, I think that's still illegal here, and it's legal in other places. So if you need something where you need
legal in stem cell cloning is legal in some countries. I don't think it's legal in the US.
I don't think it is. So if you need a treatment that requires that, then you have no choice but to go overseas.
Sure.
And it's like, it's interesting, a lot of people, because, you know, in Canada right next door to us has national health care. That's why people buy, like, going there for procedures or buying drugs from there, just because it's so much easier or cheaper to do so.
There's still a very big swath of people who, rightfully so, they don't know much about medicine, so they depend on their doctors, and therefore they can get, I don't want to say tricked, but it's very easy for a doctor to say you should be taking this to help you, like X medicine, and then eventually you find out X medicine is like not really needed or is actually harmful or something, you know?
Yeah, so my perspective is, some of it actually is, you know, helpful, but some of it probably isn't. And yeah, definitely, like I said earlier, like, I think some doctors are probably getting paid by pharmaceutical companies to prescribe certain medications. In that case, that's kind of messed up, right? Like, because they might be prescribing something that someone actually may be taking for the rest of their lives, or something they don't really need. Yeah, it just seems like sometimes, you know, the medicine's being prescribed not for the right reason. It's more for capitalistic reasons, not to really help someone out.
Yeah.
Who knows? What I was also going to say about the quality of doctors is you don't really know where, like, let's not even talk about, so I have this friend who, what he does as a job is he basically sets doctors up or from overseas with practices here, so they can start, you know, like, go through rotations and whatnot, so they can ultimately become a doctor here. And, you know, there's people who, like, usually, you know, like, if you look at this as an American, like there are certain schools that are known for to be good as a medical school, which
Yeah.
honestly I don't know how much that helps, to be honest, but at least we know, generally speaking, if you're from this college, you went through more rigorous courses and whatnot, and you're more likely to be a better doctor.
Yep.
But then, like with my friend, I'm not saying like his business is bad or anything. It's just, but like I don't think there's much regulation on who can practice here and who can't, per se. I mean, I'm sure that, like, I know you have to take the MCATs if you're an American doctor, but I don't know if you have to do that if you're coming from a different country. So
Yeah. What qualifies someone as a doctor? I think it's just you passing tests, and maybe you have to
Probably.
do a residency.
yeah, you
I
have to
don't
do
know.
residency. You do have to do residency, and then you have to go work in, like, I think so. You do 4 years of med school, and I think you do a year or two of residency, and then there's one other thing after that. I think you have to do before you fully become a doctor.
The other thing I kind of fear is when doctors start like saying, "Oh, we should run these tests."
Oh yeah, when they do
Because
like excessive amounts of testing.
they're like, "We should test this and this," and I'm like, I can just see the dollar signs racking up."
Yep. Yep.
Because like an X-ray now is like a couple $100. I'm like, what the?
Are you serious?
Yeah, aren't X-rays like a couple $100?
God, I hope not. That's ridiculous.
I'm pretty sure they are.
I
Like
actually paid
before insurance. Maybe after
Oh.
insurance they're not, but oh yeah,
That's
X-rays are
that's
expensive.
bullshit. The
And they
X-rays have
take
been around
like
for
3
so long.
seconds.
Yeah, well, like I think I only paid like $5 or $10 for an X-ray for my teeth. I mean, it's a small X-ray, but
No,
that was in
seems
Taiwan.
really low.
That was in Taiwan.
Yeah, you're not X-rays in the U.S. No way.
You can actually
Even
get
for
like
teeth.
you can even get body scans for really cheap in Taiwan. So let's say I didn't have health insurance, right? So
Mm-hmm.
I think my tooth cleaning would probably have been, let's say, $150, and I had apparently my dentist here in the States said I only had to get one filling. I ended up having to get two apparently in Taiwan. So and I probably also have to get an X-ray here. So like, okay, so let's just say for the tooth cleaning and then the cavity fillings, that's like even with insurance, right? You're paying like $15 a month, so that 15 times, that's $90, right? Let's say it's $90 for tooth cleaning, but you're already paying for health insurance, right? Or dental insurance, sorry. $90 there. You're probably looking at least $100 per tooth, minimum.
Sure.
So
Sure.
that's run up to $300, just in case one tooth filling costs more. $300, right?
Yeah.
That's half of your airfare right there. And how much I had to pay when I was in Taiwan was $150. So you net $150, right? So you take that $150 towards your airfare, then you're taking a flight for an additional $450, and you get to go have some fun.
How does it work when you get a procedure overseas? Do you just walk into a dentist's office and be like, "I want this done"?
Well, so I called in advance and I told them, hey, like can I schedule an appointment? Because you probably should, regardless of where you're at, just to make sure there's time to go in, and cause they have time for you, because dentist office is more than likely going to be booked that day unless they have an opening. So
Right.
you should probably go to one where you can actually speak the language. Would probably be a good idea. And then
Yeah.
or if you know someone who can translate for you, that works too. And then yeah, and I went in and I was like, hey, I need to get my teeth clean. I also have a cavity I need filled, and then have them hopefully leave enough time. Ask them if they can leave enough time for you to do that. And I think you can usually get a general ballpark estimate. They can't tell you exactly what it is until they look at your teeth. But yeah, I got a tooth cleaning, an X-ray, two fillings for $150.
So let me ask you about your comfort level with an overseas procedure. Like, for me, doing it may be like just because I've only done everything in America.
Mm-hmm.
How do you feel? Like, for me, I feel like I'm still, even if I was to do a dental cleaning, which is not that
Mm-hmm.
major of a risk.
Mm-hmm.
Like, how do you feel it is in Taiwan? It's just, you think it's like
the
the
same.
same?
I feel like it's the same there as here. They may actually be a little bit more efficient with getting you in and out the door, which I'm totally okay with. Because like we've been talking about, the inefficiency here is fucking ridiculous.
It makes sense. I mean, people in Taiwan need dental cleaning too.
Right. I've had it done a couple different ways. So here, every time I've gotten a tooth cleaning, it was always they always use like that metal pick.
Yeah.
And then what they did in Taiwan for me is they use like this. It's kind of like a water pick, but like more industrial, I guess. So they flush out all the stuff, and then they'll go back with the pick if needed to clean out the rest. So I think it actually may be even cleaner because they're using more than one method to clean your teeth. I mean, and then for like, sorry, and then I was just gonna say for like a major procedure, it's probably fine as well. I would just make sure, like, just like here, make sure you find a good doctor, right?
Mm-hmm.
Because you want a better doctor to hopefully to take care of, everything versus one that might be not as experienced or something, It's the same situation. Let's end this on talking about anti-vaccinators.
Yeah. Okay.
What's your opinion on this subject matter?
To be honest, I think that... Didn't we talk about this before? Maybe not. Maybe
I think we may have.
We kind of brushed it in another... Well, my stance today is... I am not against vaccinating. I can see why people would be... So what would I do personally? I would probably vaccinate my kids.
Yeah, like I would. Okay,
I wish I didn't have to. Let me put it that way. I would prefer not to have to, because I would like my kid to be able to like develop like all the immunity and stuff and kind of.
Well, yeah, but like,
I don't want to put, but I trust medicine enough nowadays, and I know it's so dangerous nowadays to not be vaccinated. Like, you can't like.
Right.
There's so many like diseases we've already figured out the cure for.
Right.
Whether it be like meningitis or rubella, polio, stuff like that. We've already figured it out and we've already eradicated it. So there's no reason to not vaccinate, I feel, in my opinion. If my child could live a quality life and get through life without having to vaccinate, I would prefer to do that, but the risk is too high. You know, it's like a child not being vaccinated is, I feel like it'd be so risky. It'd be like and especially when they're young, like if they're in the same room, like in preschool, as a kid who has a cold or something, and suddenly they start getting like pneumonia, or I don't know. I'm just throwing out random medical terms, but like I feel like them not being vaccinated could hurt them in the long run. If there was a way that I could perfectly protect my kid, then I wouldn't vaccinate them. But
that's
in
not
the
gonna
real
happen.
world,
Yeah.
that's not the real world. So yes, I'm pro-vaccinating, because in this world, there's no way to 100% protect your kids, and we've already established like the medical standard of, MMR, all this stuff is already cured. I shouldn't put my child at risk.
Right. So one thing I have to add is, I thought anti-vaccinators were people who just didn't give any kind of vaccine shots to their kids, but apparently it's the essential vaccines, but not anything extra. But I feel like from what I hear in the news and stuff, these parents aren't actually vaccinating them with like stuff like MMR, and I think if that's so, I'm definitely against it, because you definitely need that, and you don't want your kid getting it. And then I don't want to also be, if I had a kid, I also don't want to be that parent that got other kids sick because they didn't get a certain vaccine shot.
It might be my ignorance, but I don't know what's essential versus not essential. Like when you say like they get the essentials, what is that?
I don't know, but my guess is like MMR, and then like I don't think like the flu shot
I feel
is
like
necessary.
every kid at birth automatically, no matter if they're an anti-vaccinator or not, they get some kind of shot.
Are you sure
just
about
as
that?
like I feel as a like a almost like an immunity booster, just because a child being born is so exposed to so much stuff in like
Especially in a hospital.
Yeah, in the first couple of days. I think every child, no matter if they're anti-vax, this may just be my ignorance, but
Maybe.
I think that's what happens. I think it's like because physically a kid coming out of a womb is so subject to so like there's a core shot that kids get.
Maybe, but what I was gonna say is I feel like MMR shots aren't, you don't get them, you don't have, like, you get them before a kid goes to like school,
right?
So I guess like when like stuff like you don't want to, even though
like
small
measles,
yeah, and then like smallpox is not really around anymore, but you never know. But so like what I would consider,
it's still around in certain countries,
right?
It's still
like
it's like what's the thing, like chicken pox, like
well, chicken pox I feel like everyone usually just has to, like every kid gets it at some point and kind of just has immunity because it's a virus, right? Well, I guess that's what vaccines for. I feel like every kid just ends up getting chicken pox sooner or later, and it's just part of life.
Yeah, but you can still die from chicken pox.
Oh, you can, but I think most kids just get chicken pox and you apply that whatever pinkish stuff on there, and it just goes away after a while.
Maybe I'm thinking of like,
unless you get, there may be a vaccine. I don't know. I don't think I got it. I think I got chicken pox at one point and kind of just overcame it, and that was that.
Right.
But anyways, what I was saying is like I feel like stuff like maybe chicken pox, you don't have to get, like flu shot, you don't have to have.
I don't get flu shots.
I don't get flu shots. I've even had coworkers who got them and they weren't feeling so well after they got it.
I feel like people at work who get flu shots are more prone to getting sick.
Maybe it's all a conspiracy. Who knows? Maybe they're just
like
trying
they're
to kill
like
everyone.
I need to get my annual flu shot, and these people are like the same people who get sick a lot of times during the year.
Yeah.
I literally get sick once or twice, if even twice a year.
Well,
I probably average like once a year I'm actually like really sick.
Yeah.
But there's people at work who they get a flu shot every year and yet they get sick a ton.
Yeah.
They take out like 5 times a year. I'm like
maybe they just have weaker immune systems.
Probably.
Well,
I don't know, but is that genetics, or is part of that based on I never got flu shots, so my body developed that kind of strength?
I know I probably got a flu shot at some point, but knock on wood, I haven't had flu in a long time. But for flu, I hear sometimes it just depends on that year's flu vaccine. Sometimes it's just not as effective. Sometimes it is. I don't know. I mean, like the only thing I really get is usually a sinus infection these days, and it kind of started from, I don't know, having colds that last a long time in Taiwan. Maybe just a change in environment, but I get sinus infections. That's about it. Other than that, self-inflicted hangovers occasionally. So,
hair of the dog. That's that cure.
Well, till the next day, you kind of have to balance it out. But, anyways, yeah. I think we're on the same page about anti-vaccinators. Like, hey, like at least vaccinate your kids with the important stuff.
I get why the parents don't want to do it, but
right.
The problem is in this world. You can't really take that stance. It's hard to take that stance. Like Yeah, I can see why you do that, but wouldn't you be worried? Like, if you were a parent and your kid never got vaccinated, I'd be so worried. Any public interaction the kid had,
Yeah, I feel like
they'd be so prone. I'd feel like I'd be worried about them all the time. And yeah, I get like they're gonna build the immunity naturally or organically, but
not always.
you can't, like, disease is like an unseen silent killer. You can't,
Right.
you don't catch it like in time. It can be too late.
Yeah, I mean, your kid can actually die from this.
Yeah, especially
it's
when
no
your kid
joke.
is very young.
Yeah. I think people are just becoming all hipster and shit. And there's a huge health craze now, which is totally fine, but I feel like it also is getting a little, I don't know, sometimes I feel like it's a little out of hand. Like, I'll go to a grocery store, I'll have a variety of foods. I mean, like, I'll get some healthy food, like, you know, some vegetables and whatnot, but you see, like, I feel like I see so many carts where people have, and everything is healthy in there, and I'm just like, wow, guys.
Yeah, that's my cart.
I have nothing wrong with it. It's just I feel like everything should be done in moderate.
Well, something I see a lot now that I want to bring up is I don't know why people get migraines, or
I don't know
have
either.
to, or there's a lot of people who take like Tylenol or Advil a lot.
Yep.
Like,
I
who
know
have
people
like
like
a
that.
bottle of Advil in their their office drawer, and they may have both. They may have Advil and Excedrin or whatever.
Well, in case one doesn't work.
Like, for me, I don't know, maybe it's just a heavy headache, but I've never had what I would consider a migraine. But maybe my understanding of what a migraine is not, because I've never had something so excruciating where it's like I can't like see light, like I'd be affected by the
Or like
light.
noise.
I've had headaches, but very rarely have I had headaches. It may just be genetics, or it may just be something else, but I see a lot of people almost dependent on like Advil. Like, they take it.
Right.
Maybe for Advil also works for like heart. It's also good for the heart. People say take Advil, or is it
Right.
or whatever.
It's-
Bayer, when you have a heart attack.
Bayer makes Advil.
But like Tylenol or something, like they like pop headache medicine. I never like understood like how somebody is in that situation, you know? Like, do you have headaches every single day, or every like once a week?
That's all for this week. Thank you for listening to the podcast, and tune in next week for more stories about what has got us shaking our heads.